Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this episode, Dr. Anu Bajaj, a board-certified plastic surgeon, talks to us about realistic expectations for plastic surgery results.
Hi, I'm Connie Franklin, and I am here today with Dr. Anu Bajaj. She is a board-certified plastic surgeon, and I would like to take an opportunity to get to know you a little bit and about your experience, how you got into the field, and your expertise.
So I have been in practice here in Oklahoma City for, over 15 years, since 2007. And I started out as primarily doing breast reconstruction after cancer. My passion had been reconstruction after cancer, actually. And then my practice has evolved into an aesthetic practice over the past 5 to 8 years. And that's a whole different aspect of reconstruction. And even though it's aesthetics, you're actually using all the same tools you learned in your reconstructive practice to
And
do
what
it.
made you want to get into plastic surgery?
So I became a plastic surgeon because when I was a medical student, I had the opportunity to scrub in on a surgical case. And it was an older gentleman who had a mandibular cancer, squamous cell carcinoma of his jawbone. And the ENT, or head and neck surgeons, removed his entire jawbone and did a big neck dissection and basically left this man filleted open with a hole in his neck and face and left. And the plastic surgeons came in and put him back together. And so that's why I like plastic surgery, because what we do is help put people back together, whether it's after cancer or an accident, or aesthetic surgery is the same way, because we're helping people by removing things or changing things that bother them and helping them be who they want to be and put back together.
I also know you're an artist. So how do you feel like those two couple together?
So, as a painter and an artist, I love the human form and I love doing figure painting and figure drawing. So, I think my art of, has made me a better surgeon because it's trained my eye. So, when I do my figure painting and figure drawing, I'm working from a live model. And so, what you start to learn is that everything starts to shift, and you have to be very observant about angles and space and how things look differently in certain situations. And so, I think my art has improved my surgical skill by changing my eye and allowing me to be aware of all the minor changes that can occur.
And I've heard you say this before about how you don't do the same techniques over the years, right? So your tummy tucks today look different than they did 10 years ago. Tell me a little bit about how you've advanced your techniques and how that evolved.
So, in general, I think the best surgeons, or even the best physicians, anybody who's good at their job, will evolve over time. In other words, they will start with a certain skill set, and then they will continue to observe how their own patients do, how their outcomes are, read more articles, talk to other surgeons, and change their techniques accordingly. And so, when I first started practice in 2004, my tummy tucks were very different because, for example, I used drains. I wasn't as aggressive with how much skin I removed. I wasn't as aggressive with the liposuction. And over the years, my techniques have evolved. I no longer use drains. I use a no drain technique. I use enhanced recovery after surgery protocols, which ensure a more rapid recovery for patients. And I think any good surgeon will evolve their techniques over the years because, for example, even with my facelift techniques, those have changed because you have the opportunity to do a surgery, know what you did in the operating room, follow that patient for several years and see what the outcome is and how it ages, and then you can think in your head, well, how can I make this better?
Mm-hmm. And then you get to apply that going forward, right? So a lot of times if you do something and then you see what you could have done better, well, you will have another patient that walks in next week and you can apply that same
Exactly.
knowledge and that experience.
Exactly. Or you can say, well, okay, this patient that walked in is a little different from the one I did before, so I need to adapt what I did in a different way to get the outcome I want. And so I think it's important that you are fluid and constantly educate yourself.
And everybody's an individual.
Exactly.
So someone's before is going to be their very own before. And that's another topic I've heard you speak about. Do you want to go into more detail on before and afters and people's unique starting points?
So I think when people think about plastic surgery in today's world, we are obsessed with Instagram and TikTok and social media. And so we think that it's a menu item. Well, so this woman on this Instagram page had this before and after. So that's the result I want. And that's actually not a realistic expectation. You start with where you are, and you are your own canvas. And so your results are going to be based on who you are. And the other thing that I think affects our expectations is most of the before and afters on today's world and Instagram are immediate, like on the operating room table. And to be frank, all surgical results will take about a year to evolve. So trying to say that this is how you're going to look after surgery forever is completely misleading. And I think that's another thing that all individuals have to understand as they approach plastic surgery. And so what I encourage people to do when they're looking at before and afters is to find a before that looks like them. Because if I were to have surgery, my before will likely look a little bit different than yours. So find a before that looks like you, and then you need to really be critical and talk to your surgeon to ask him or her to show you afters that show the recovery process up to a year after. And that's an important distinction. For example, in many of our surgical meetings, in today's world, when we show our surgical results and we're giving educational talks, some meetings will even have a requirement that you cannot show an after picture unless it's at least 1 year after the surgery date to show what the evolution of the result is.
So that kind of leads me to another topic about maintenance and maintaining your results. Say you do a mastopexy and 5 years later they come back in and say, oh, it's like this never even happened, or it's like I've never even, and then you want to show them their befores and their 1 year later and how their own body, their own skin elasticity, and then also with liposuction and mommy makeovers and how the fat, how that evolves with their diet and exercise.
So this goes back once again to understanding expectations when you approach plastic surgery. A lot of times we assume that if we have surgery, we no longer have to do anything or work at anything. And that's a misnomer because plastic surgery follows the 80-20 rule, just like so many things in life. Plastic surgery can get you to 20% of the improvement, and the other 80% is what you're going to do afterwards to maintain your results. So, for example, if you have a tummy tuck and liposuction, yes, I can remove all the excess skin and fat. I can tighten your abdominal muscles, and I can do liposuction. But if you don't work to maintain a healthy diet and exercise, you're not going to have the result you want 2 years later. In fact, since we have removed all the extra abdominal fat by doing the tummy tuck and then doing the liposuction, if you were to gain 20 to 30 pounds, you're very likely to gain it intra-abdominally, which is the fat that grows around your intestines and your liver and stuff. And that's going to even give you a rounder abdomen, which may even be worse than what you had before. So it's really important to understand that after any surgical procedure, you have to work to maintain the results. And then going back to the mastopexy, when a mastopexy as a breast lift, we want to raise our breast and reshape it so it sits on our chest wall. And 5 years later, if it's sagging again, it's related a lot of times to skin elasticity and the lack of collagen in the breast, or it could also be related to the implant. If you were to have a mastopexy and an implant and you selected an excessively large implant, it's going to, in a couple of years, it's going to sag again because gravity's kind of hard to get rid of, to be honest.
I always say, oh, I see you've met my friend Gravity. And then about bras. So sometimes a patient will say, I don't want to have to wear a bra after surgery.
So the response to that would be, if you feel comfortable, then don't wear it. But there's no magic surgery that's going to mean you don't have to wear a bra. when you're young and you're 20 and your skin has fantastic elasticity and you have young, perky boobs, you may feel comfortable not wearing a bra. As you get older, it's a natural consequence of age that our skin loses elasticity, and it becomes more pronounced after menopause. And if you also have large breasts, you may choose to wear a bra. So actually wearing a bra has nothing to do with plastic surgery, but really has to do with your comfort level of going braless.
So do you think there was a myth, or it kind of debunks the myth that I think when we were told when we were younger girls, if you don't wear a bra, you're going to have saggy boobs as you get older, and it's something just our grandmothers used to tell us, right?
Right. I don't think that's true. In my opinion, it's more genetic, and it's not. If you have never had plastic surgery before and it's your own natural breasts, then whether your breasts get saggy or not is more of a genetic thing. And just like some women will have a baby and they will have no stretch marks and no excess skin afterwards. Other women will have a baby and they've got so many stretch marks and so much excess skin and their belly looks like a train wreck. That's kind of genetics and bad luck, right? And it may also have a little bit to do with how you take care of yourself, what your nutrition is, and and all of those things will also play a role, but that's already happened. So I don't think a bra has anything to do with whether you're going to sag or not, I guess is the point.
I guess so. Well, thank you so much for walking us through so much information. If there's any other questions, or if people want more detail on this, how do you suggest they go about that?
Well, so they can most likely just go through to my website or to the Instagram page and message me and ask me questions. Other tools are for generalized information. The website for the American Society of Plastic Surgeons is always a good resource, which is plasticsurgery.org, and that always has well vetted and true scientific information as well.
Thank you.
If you wish to contact Dr. Bajaj, her office phone number is 405-810-8448, or visit her website, bajajplasticsurgery.com. Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health.